Good afternoon, folks who are joining us. Thank you for joining us on what is our final workshop of our virtual conference. And I'm going to wait just a little bit until people get into the right space, and then we'll get started. I'm going to wait just a couple more minutes. All right, so we'll go ahead and get started. Good afternoon, everyone. I'm Sally Morris. I'm the Communications Manager for the ARC of Indiana. And thank you so much for joining us today. Just a couple housekeeping things. During today's session, cameras and microphones for all attendees will be turned off and locked. But if you have any questions if you hover down at the bottom of your screen, you'll see a Q&A box, and you can type your questions in there. And then at the end of Stephanie's presentation, I will share those questions with her and we'll get some answers. Thank you for joining us today. Stephanie Gage is the BIN project coordinator for the IIDC Center for Careers and Community Living. And we'll be talking about the Benefits Information Network and how that can help. I also want to thank our sponsor for this session, Safe Dose, and all of our sponsors have made it possible for us to hold these virtual meetings at no cost, so we greatly appreciate it. And so I will now turn things over to Stephanie.
Thank you so much. I appreciate it. Okay, well, thank you all for being here this afternoon. I really appreciate you attending. Today we are going to talk about something that I love very much, benefits counseling and the BIN project. So without further ado, let's jump into it to find out what BIN is and how it can help. So BIN actually stands for Benefits Information Network. And what it is the Office of Vocational Rehabilitation Services, VRS, funds for the BIN project. The Indiana Institute on Disability and Community, IIDC, manages the BIN project, and Social Security Administration partners with us so that we can develop capacity building throughout the state of Indiana to help more people get work incentive planning and assistance services. And we do this through engaging providers and community advocates to help support that work incentive planning and assistance so that individuals with disabilities that receive benefits can understand how working and benefits correlate and be able to maximize income and try and work. So we do this capacity building through employment providers throughout the state of Indiana, sending individuals to get trained and certified to be a BIN liaison. And as a BIN liaison, what they do is learn about what benefits are available, how working can sometimes impact those benefits, and some great work incentives to be able to educate individuals on how working can sometimes impact their specific benefits. Now we're going to learn about how this is very individualized. So one of the wonderful things about the BIN project is a lot of these BIN liaisons actually work in other positions to help support an individual on their path to employment. So it may be your employment specialist that you work with also is a BIN liaison or works in the same agency as a BIN liaison so that you can get that access to individualized benefits counseling with a familiar face. Now, we have about 150 liaisons that are certified annually to provide this support, which means that they can do around 1,000 plans each year. And a plan is what the product that they come up with. It's actually called a strategic plan. And what it is after they meet with a person and gather information and verify all their benefits, they compile that together with their earnings goals and what applicable work incentives might benefit that person in a nice report so that they can share that out with the individual to help them organize, what benefits do I receive? Who do I need to report to? How do I do this? What are the next steps? So that is what those strategic plans are, is to help educate individuals so that they can learn that they can work even if they're receiving benefits. So because we're able to do about 1,000 of these or more a year, that means lots of people are getting this education. But we think that it's really important to make sure we touch as many people as possible with benefits counseling, because we know that more than 1,000 people in our state could benefit from that information. And the reason that BEN is so important in benefits counseling is because one of the biggest barriers for an individual with a disability who might want to work is that fear of losing their benefits. We all know that those are a much needed safety net. And the thought of losing that just because you want to try to work can sometimes be overwhelming. So that is why benefits counseling is really important. And that fear that an individual has a lot of times has been heightened by misinformation. They may have heard about benefits from friends or families, or sometimes even people that are trying to help them, but don't really have that education behind on benefits and working, can give them misinformation. And that misinformation can really be detrimental because it can make them think that there's no way that they can work and still receive their benefits. So that's why benefits counseling is really very important. It is very individualized. Each person and their particular situation is different. There's different types of benefits. Earning levels are different. So it's important to get information specifically about your benefits, your earning goals, and whether or not there would be any impact on those benefits if you go to work. There's no one-size-fits-all answer for benefits, unfortunately. So now that we've learned why it's important, let's go through some of the common myths that we in the field hear all the time about benefits and try and dispel those a little bit. So the first myth is, if I go to work, all of my benefits will be taken away immediately. And the good news is that's false. Lots of people are actually able to work and keep their benefits. It really depends on what type of benefit a person's receiving, the earning levels that they're looking at, and where they might be in different timelines associated with those benefits to understand whether or not working is going to have any impact on your benefits. As I stated before, and you'll hear me say a couple of times more in this, it really is very individualized. So just because one person might have gone to work and it impacted their benefits doesn't specifically mean that it's going to impact yours. Lots of people work and keep their benefits. The next big myth is that there's only one type of Social Security disability benefit. And there are actually two different types of disability cash benefits that a person might receive. And these programs are very, very different. So it's important to understand whether you have Social Security Disability Insurance, SSDI, which is actually the earned benefit. It's based on a person's work record and taxes that they've paid through their work or self-employment, or if they receive Supplemental Security Income, SSI, which is the needs-based disability benefits program. So it's important to find out which benefit you receive, because working affects each of these benefits very, very differently. And to make things even more complicated, some people actually receive a portion of both of these benefits. So they really need to understand that, which check is for which amount, and how is working going to impact my SSDI, and how is it going to impact my SSI. So there are two different types of benefits. It's also important to note that there are two different programs called Medicaid and Medicare. And a lot of times people think that these are the same program, probably because their names are so similar. But these are two different programs. And depending on which of those Social Security disability benefits you receive is going to determine which of these programs you're actually eligible for. Just like with SSI and SSDI, some people actually are eligible for both of these forms of health care. And depending on which Medicare or Medicaid program you're in, earnings may or may not impact this coverage. So it's important to find out what you're on and then how working might impact that benefit. Sally, do we have any questions yet?
Sorry about that. Had trouble finding my unmute. No questions so far.
Okay. Well, let's go ahead and go on then. If you do have questions, please feel free to type them in the chat box and we will get to those. Or you can save them for the end as well. So the next big myth, and this one is super important, is that Social Security knows that you're working. So there's absolutely no need to report earnings. This is extremely false. I wish this was true, but Social Security does not have a crystal ball. They don't know that a person's working until you let them know. They will eventually find out, but they need to know in a timely manner whether somebody's working or not, so that they can determine whether or not they should receive a benefits check or how much to give them. So it is extremely important for beneficiaries to know how to report, who to report to, and when they need to report. One of the biggest missteps that individuals take when they start working is not reporting, and that can lead to huge overpayments or underpayments. Sometimes Social Security should be giving you more, but they don't know what your earnings were month to month. So make sure that you report. And because this is so important, I just wanted to add a slide in to explain how easy it really is to report. There are multiple ways that you can report to Social Security. You can do this online through my Social Security account, which is very easy. You don't even have to go to the office, just get on your computer and log in and report your earnings. You can actually take the pay stubs to your local Social Security office. Now, if you choose to do this, make sure that you keep the original pay stubs for yourself. I recommend getting a folder or a binder, somewhere that you can safely keep those and know where to access them. And if you do take copies in, make sure that you ask for a receipt. That receipt is proof that you turned in your pay stubs, so that if Social Security ever said, well, we didn't get your pay stubs, you can pull out that receipt that you got and say, yeah, actually I turned them in and I have proof right here that I turned those in. So take the steps, get some sort of folder or binder, and make sure you're keeping your original pay stubs and those receipts. You can also mail copies of your pay stubs to your local Social Security office. Again, if you do this, then they should be sending those back to you. And that shows proof that they got those pay stubs. If you do mail them, make sure that you put on the outside of the envelope whether it's attention SSDI or attention SSI, because these are two separate departments in Social Security, and you want to make sure it gets to the right area. You can also, if you're receiving SSI, call the SSI TWR toll-free hotline at 1-800-772-0953 within the first 6 days of the month to report those earnings, or use an app. So if you worked in May, you would want to make sure that you called and reported your earnings by June 6th. Also, make sure that you report to any other agency that you're working with or receiving benefits from. These offices and agencies actually don't share records. So, if you receive Medicaid or SNAP benefits or housing assistance or are on a Medicaid waiver, you would want to make sure that you report your earnings and that you're working to all of those agencies. Okay, so the next myth that we're going to go through is that everybody's benefits are affected the same way. And I think you've heard me say this a couple times, but it's really critical to understand that they are not the same for everyone. This is one of the biggest reasons that benefits counseling is actually critical for people to get connected with, because there are multiple factors to take a look at in determining whether or not working is going to have any impact on your benefits and what work incentives are available to you. So you first need to determine what benefits you actually receive, if you've had past work activity or not. So that helps determine maybe what timeline you're in with your benefits, what earnings level you're looking at. Some people may be looking at working part-time, but part-time can mean 10 hours, it can mean 20 hours. It varies based on the pay rate as well. Or you may be looking at full-time work. So all of those things come into play when determining whether or not working is going to have an impact on the various benefits that you receive, not just Social Security benefits, but all benefits. So it's really important to understand that. All of these things really do need to be verified before somebody can tell you whether working is going to impact your specific case or not. And that's why I said, a lot of times people get misinformation because maybe they heard, well, my friend's sister started working and she said her benefits stopped. Well, we don't know what her earnings goals were, where she was at in different timelines, or what benefit she was actually receiving. It might be completely different. She might have been on SSI and you're on SSDI, or vice versa. So it's critical to get specific information to you. And a huge myth is that Social Security doesn't actually want people to work. If you're on benefits, Social Security definitely wants you to at least even try to work. If you think about it, that's how Social Security actually funds the Social Security system, is through people working and paying back into that system. So even if it's only part-time, Social Security definitely wants individuals on benefits to try and work. And they actually offer some really amazing work incentives to help people try to work. And if they need to keep benefits for a while, some of these work incentives can actually support that. So this slide is just to show you that there are lots and lots of work incentives. We're going to go through and highlight a couple different work incentives and how they relate to protections. But I just wanted you to see that there are multiple work incentives. And the other thing on this slide that I wanted to highlight is that there's a list of 2 different sets of work incentives. Again, because the SSDI, or Social Security Disability Insurance Program, is vastly different than the supplemental security income, they both have separate work incentives that are attached to them. And that's another reason why it's important to get individualized benefits counseling to know which of these are applicable to you. And the key word here is incentive. All of these were created to really incentivize people to try to work. You know, try to go out there and work, and we're going to support you in that goal. And if it doesn't work out, that's okay, but we're going to try and help you get to your self-sufficiency goals. Are there any questions before we get into some of these work incentives?
We have one question. Does a guardianship affect the ability for someone to receive benefits? Sorry for my dog barking in the background. Also, if the parent is the guardian, is their income part of the calculation of benefits?
Okay. I'm sorry, I couldn't hear the first.
I'm sorry. Does a guardianship affect the ability of someone to receive benefits? Did you get that?
No, a guardianship does not affect their ability to receive benefits. And a guardian or a parent's benefit or a guardian's benefit may impact the amount of SSI and the ability for somebody to get SSI, depending on if they're receiving SSI as a child or as an adult. As a child, they're going to look at the whole household's income to determine whether they're eligible for that, and how much they receive. When somebody turns 18, then they're looked at as an individual. But if they're receiving support for their basic needs like food and shelter, they may receive a reduced SSI check based on that. There is also some deeming factors. You know, if you have a spouse that's working and you're receiving SSI, some situations like that. Again, it's very individualized on the effect that earnings might have, even from the others in the household, on benefits. Are there any other questions before we go on?
No other questions right now. There is someone saying they're having trouble hearing you.
Okay, do you need me to speak up? Is this any better? I'll try and speak a little louder. I'm sorry. Okay.
Thanks.
Perfect. Okay, thank you. All right, so we talked about how there are lots of different incentives, and what they do is kind of different. There are some incentives to actually work and keep your benefits eligibility. So just to highlight a couple of those that actually specifically help you work and keep your benefits eligibility. For somebody on SSDI, Social Security Disability Insurance, there is something called trial work period, which is a wonderful opportunity to test your ability to work. And you actually are able to keep your full SSDI check. And so there's 9 months that they allow a person to earn anything that they want and keep that SSDI check. There is also an extended period of eligibility for somebody on SSDI that gives them 3 years to test their ability to earn and it not impact their eligibility to SSDI. So you may or may not get your SSDI check during that time frame due to earnings levels, but your eligibility or protection to receive that benefit again if you needed to is protected. So those are a couple of great ones for individuals who receive SSDI. For SSI, there's something called income exclusions and the 1/2 offset. And what this does is it allows for a gradual reduction of an SSI check when somebody's working. Now, for SSI, they do calculate your SSI check based on your earnings. But it's important to note that they count actually less than half of a person's actual earnings when they do that adjustment. So for somebody on SSI, it means that they're going to get more through working and having a slightly reduced SSI check. So that's a great incentive to try and work and live above that base SSI rate. And for both SSDI and SSI benefits, there's a great timeline of protection called expedited reinstatement of benefits. And what that does is if somebody works their way off of benefits but does need them again and they still maintain their disability, it allows them to be quickly reinstated to benefits. So all of those incentives are specific to trying to allow you to test your ability to work and maintain your eligibility for benefits. The next work incentives that we're going to talk about on this slide are specific to healthcare coverage and protecting that much needed healthcare. For some people, they're not worried about losing that cash benefit, but they may be more concerned about maintaining their much needed healthcare coverage. So through work incentives like 1619B, an individual is actually able to maintain their Medicaid, even if that SSI check, if they're earning so much that their SSI check reduces to 0. So that is a great protection that's there so that somebody can really try to work and work to their full potential. And if they need to maintain that Medicaid, have that protection there. MedWorks is another Medicaid protection. This is actually Medicaid specifically for an individual with a disability that's working. That's what MedWorks stands for. It is a great program that allows somebody to either maintain Medicaid, maybe past 1619B, or for those that are maybe on SSDI and didn't qualify for Medicaid because they had too much income or resources, to be able to obtain that much needed Medicaid coverage. So that is a really, really wonderful work incentive that they have for healthcare. And for somebody on SSDI who has Medicare coverage, if they work so much that their SSDI check stops, there is an extended Medicare coverage timeline that they allow, which allows somebody to maintain Medicare coverage for quite a long time after that SSDI check stops. They'll have that for at least almost 8 years of extended coverage. So that's a really great work incentive. And the next set of incentives that we're going to go through are incentives that are related to cost or accommodations that a person has due to their disability. Now, Social Security actually really understands that if you're an individual with a disability, you might encounter expenses or costs and maybe have accommodations that other coworkers do not incur when working. So they are going to take this into account when they look at whether or not you receive your benefits check and how much you receive. Impairment-related work expenses is a work incentive that takes into account the expenses that somebody has that are related to you working and your impairment. So it's needed in order for you to be able to work and directly related to an impairment you have. What they can do is use this to reduce what they count as income for both the SSI program and the SSDI program. So this is a great work incentive. For an individual that is listed as blind per Social Security's definition, there's something called blind work expense. And for these individuals, they will actually take any work expense. It does not have to be related to the individual's blindness into consideration, and they can reduce the income that they count for SSI purposes. Now, blind work expense is specific to SSI, whereas impairment-related work expense applies for both SSI and SSDI. And the last work incentive that is listed on this slide is subsidies and special conditions. And these are accommodations that an individual has at work or extra help that they receive on the job that can actually be taken into consideration when determining what a person's making and what their income is looked at for SSDI purposes. So what that means is, maybe normally somebody in that job duty does 10 job duty, these specific 10 job duties. But due to a person's disability, maybe they say, you know what, we're going to let you do 8 of those and just focus on those. Well, they can take into consideration and put a cost or a value on those 2 job duties that they don't do, that a coworker has to, and it actually can, not impact their earnings from work, but impact what Social Security looks at towards their earnings. So these are all great things that can help somebody earn more and maybe maintain their benefits and help with the cost of some of those expenses that you might need in order to work. Before we go on to the next slide, are there any questions that came in, Sally?
A couple questions.
Okay.
The first is, can you discuss Indiana's Ticket to Work program, its relationship and effect on SSI recipients' disability medical reviews? What are the requirements for participation in Ticket to Work, such as volunteering classes, etc.?
Okay, that one you might have to email me for, because that would be kind of a long discussion in itself. But the Ticket to Work program, if you're receiving SSI or SSDI, it's a volunteer program, so you can choose to participate in it or not, with the goal of getting to work and having help towards that. If somebody's ticket is assigned and in use, then it can protect them from a continued disability review, as long as their ticket is assigned and in use and they're meeting certain milestones. The Ticket to Work, if you go to choose work, I believe that's the website, but the Ticket to Work website, Choose to Work, it has a great description of, all of those qualifications, how to assign your ticket, how to find vocational rehabilitation or an EN to assign it to, and about that protection. But it's a great program.
A second question, and then I think we have one more. This question
Okay.
is related to the impairment-related work expenses. Would travel expenses, bus or cab fare costs be included?
That varies. It depends. Transportation is one that people want to submit and should try to submit to Social Security as an impairment-related work expense, but it may or may not qualify. Everybody has to get to work. So if it's just an expense that anybody incurs, it's not an impairment-related work expense. However, if you incur a cost that's specific to your impairment, so for transportation, if you're not able to drive due to your disability, or maybe get to a bus stop due to your disability, and you need special transportation, then that could be an impairment related work expense, because it is related to your impairment specifically. But so I definitely recommend talking to your local Social Security office and trying to see if it will qualify based on your specific situation. Okay, let's go on.
Oh, no. Sorry, I
Okay.
thought I was muted and then I wasn't muted anyway. If a person receives SSDI through a parent, what are the limits on earned income?
Okay, if a parent receives, or an individual receives SSDI based on a parent's work record, they're the same for anybody that's on SSDI. So there is an SGA level, which stands for Substantial Gainful Activity Level, that Social Security will compare monthly countable income to determine whether or not you get your SSDI check. So this year in 1 month, that SGA level is $1,260 for an individual, or if you're a blind individual, it's $2,110. But all of these work incentives like subsidies and impairment related work expense could be taken into account. So, there is an SGA level, but if you have some of these things that qualify, it may allow you to earn over that, and still Social Security will look at your countable income as below it. Okay, and that brings us to kind of why benefits counseling is so important and the benefits of receiving it. Through benefits counseling, somebody can really alleviate fears of losing benefits by getting correct information, understanding how your specific situation is going to work with benefits and if you're going to remain on your benefits, or if there's work incentives that you can have put in place to help you. All of that can be done through accessing that help and getting correct information. All of those work incentives we talked about are not put in place and can't be utilized until you actually talk to Social Security about them. So this first step is understanding what might be applicable to you and then how to get those put into place so that you can try and maximize your earnings. Getting educated to prevent those overpayments, that's huge. If people knew to report monthly and how to properly do that and what all they were supposed to report, that can really be beneficial to help eliminate those overpayment situations. And I never want anybody to be in that situation because that's not a good feeling to think that you owe Social Security back money. So let's try and prevent that through getting information ahead of time and reporting accurately. Besides just understanding that, work is possible, and I feel like benefits counseling, through alleviating those fears of working, can really pave the path towards employment. And we all know that working really is a way to enrich your life beyond just money. Having more money, you have purpose and pride and access to the community and feeling a part of the community. There's so many wonderful things about work besides just that extra income. So that's really important to understand, as well as that there is the ability to safely build assets. Most people on benefits think, and rightly so, because there are resource limits, it's really hard to be able to save for the future or to build assets. But there actually are ways to safely do that. There are PASS plans, there are ABLE accounts, there are individual development accounts, special needs trusts. All of these are ways to safely build assets and maintain benefits. But you have to learn about these programs in order to be able to utilize them. So who can benefit from benefits counseling? Anybody who's actually receiving Social Security benefits such as SSDI or SSI really should access some sort of benefits counseling because this is an important benefit, and sometimes it's really hard to get on these benefits. So it's critical that you understand how to work and to safely work and work towards your goals. Those that are receiving other state benefits such as SNAP, TANF, housing assistance, all of those things can be impacted by working. So it's important to understand specifically for you what your benefits are and if working is going to impact any of those benefits. Or if you're on Medicaid or Medicare, it's really important to understand so that you don't ever find yourself in a situation where you don't have health care coverage. It's important to note, too, that a lot of times people are able to access health care coverage through an employer and working. And how is that going to interact with the health care coverage I already have? So getting specific information is really critical. So pretty much anybody who's considering work and receiving any type of benefits can really be empowered through education on working and any possible impact that this could have on their benefits. So how do you actually access this benefits counseling? If you are working with vocational rehabilitation, then you can access a BIN or be referred for a BIN through your vocational rehabilitation counselor. They can authorize for you to meet with a BIN liaison to receive information on working and have a strategic plan developed for you specifically. Even if you're not working yet, I really think that that is maybe one of the most important times to get benefits counseling before you even start working, to eliminate or alleviate at least some of those fears that you have early on about working and benefits, so that you can feel free to pursue your employment goals without that fear hanging you up. If you're not working with vocational rehabilitation, that's okay. You can still access benefits counseling. The Ticket to Work program that was spoke of before, by contacting the Ticket to Work helpline, you can actually be connected with somebody in your local WIPA project. WIPA stands for Work Incentive Planning and Assistance, and it is a benefits counseling program through the Ticket to Work program and Social Security. So it's funded through Social Security, and it is a wonderful program that can help people with benefits counseling as well. And back at the very beginning, I said that we partner with Social Security, and this is how the Ticket to Work WIPA project and BIN program work together so that we can provide free benefits counseling to as many Hoosiers as possible. So either way, however you want to access benefits counseling, I just encourage you to get that help. And before we go on to resources, let's take some questions, Sally, because I think I saw a couple come in.
Yep, we do. So the first one was regarding, I think, monthly income. It said it's the $1,660 income monthly. The SGA level, substantial gainful activity level, for somebody on SSDI, that is $1,260 a month in gross earnings. Or for a blind individual, it is $2,110. And that changes annually. Right. And then the next question, our son turns 18 in February of 2021. When should we start working with a counselor?
Is he receiving benefits now? If he's
yeah, it didn't indicate that.
Okay. If he's when he starts receiving benefits, that's when you would want to get him connected. Even if he's not working yet, he would want to get connected with those benefits counseling as soon as he starts receiving some sort of benefit. And actually for young people, there is a wonderful work incentive called Student Earned Income Exclusion for students that are regularly attending school and under the age of 22. That allows them to actually keep all or most of their SSI check while they work. So it's an awesome work incentive. And Social Security just needs to know that somebody is a student and have them listed as a student to utilize that. So I would definitely encourage young people as well to get that benefits counseling.
Thanks. And just two more questions. The first is, how do I get an appointment for benefits counseling? Okay.
Well, if you are working with vocational rehabilitation, you would just want to contact your vocational rehabilitation counselor and say, I'd really like benefits counseling, and they can authorize it's called a BIN referral. And what they would do is connect you with a BIN liaison in order to get that benefits counseling. If you are not working with vocational rehabilitation, but you still would like to get some of that benefits counseling, then you can call that Ticket to Work helpline, and they can connect you with the WIPA project over your area. And Indiana has two. They have one that's for the northern and central Indiana and one in the southern region, but they can provide that benefits counseling as well.
Okay, and then I'll combine these last two questions.
Great.
If you get paid every 2 weeks, how do you convert that to monthly income? And then also just again, a clarification on what is substantial gain, SGA for someone on SSI.
Okay, for SSI, Social Security looks at income differently. It's not SGA level. They adjust a person's check, their SSI check monthly, based on what their countable income is. And remember, that's less than half of what their actual earnings are. So, you know, they have a special formula to determine what somebody's SSI check is. So lots of people earn over that SGA level and still may be able to get some of an SSI check still. So that's different than the SSDI program, which is why it's kind of complicated. And the other part of the question, Sally, I'm trying to remember.
Oh yeah, if you get paid every 2 weeks, how do you convert that to monthly income?
Okay, well, if you'll need to report your earnings monthly by your pay stubs. Social Security is supposed to look at it when the income was earned, not specifically when it was paid to you. So that's why it's important to report monthly. And if your checks kind of straddle months, you may need to turn in your work schedule so that they can allot what you made in June differently from July. A lot of times, if you're trying to kind of calculate it yourself, you can take your hours that you work times the pay rate and times it by 4.3, and that'll give you a good average of what you're going to be making monthly. But really turning in all of those pay stubs and your schedule, Social Security can help in calculating what specifically your monthly earnings were. Did that answer the question, or are there any follow-up questions to that, Sally?
There wasn't a follow-up, just one final one. Does BIN counseling include discussion of ABLE accounts, past accounts, IDA, and I would add like special needs trust, like the ARC Master Trust 2 is sometimes used as a vehicle for folks who want to build assets. And so that's always an option as well.
Absolutely, yes. That is included in the benefits counseling. It's not just how working might impact your benefits, but what are the best ways to maybe be able to build up those assets and understanding those. Yes, so all of those are included in that benefits counseling to not only help you, understand the benefits, but how to safely save and be able to achieve future goals and build up on those assets.
Thanks. That's all the questions we have right now.
Okay. Well, I do have some resources I want to point out. If you go to our website at IIDC and look under the BIN program, there's 24 different fact sheets on work incentives because there are so many of them. So I encourage you to go and look at those. You can print those out to learn more about that. The Ticket to Work program, I knew I had it in here somewhere, that how to use it and how to assign your ticket is at the choosework.ssa.gov website. in order to find more information out about that Ticket to Work program and what the different milestones are so that you can keep your ticket active. Social Security office locator, that's really important because sometimes people don't know where their actual local office is. I know the mail comes through the Baltimore office, but you have a specific one designated by your zip code. So that is the office that you should report to monthly. Division of Family Resource Office, it's important to know where your local one is. And that last resource down there is access to a guide on work incentives provided from Social Security. It's called the Red Book, and I definitely recommend looking into that. It can answer a lot of questions about working and the different work incentives that are available. Some additional resources, Indiana Disability Resource Finder is a really important resource. It's kind of a one-stop shop for locating different resources throughout the state that you might need. I encourage you to look into that. Indiana Housing and Community Development Authority, if you have a need for housing assistance or to look into those individual development accounts, that can be done through their website. The National Disability Network and then the ABLE National Resource Center are some other resources that I have listed there. So lots and lots of resources. I know it's 2 pages of them, but I think that it's important to make sure to know where to go to find out more information. So we can, I saw a couple of other questions come in, Sally.
Yes, there was a question on where we could find this presentation to view. They said this has been very helpful, thanks. And I provided the ARC of Indiana's website is arcind.org, and there's a YouTube icon at the top of our website, and we will have that posted hopefully next week because we are recording the session.
Great. And this is my direct contact information. You can still ask questions, but I wanted to make sure that you were able to see this. So if you have more specific questions that you don't want to ask on a presentation, feel free to contact me, or if you need more information, I'm always happy to answer questions or try and get you in contact with somebody who can provide that assistance that you might need.
And then we had one more question. I have a question based on reporting income to Medicaid. I turn in income tax information annually. Is there a benefit to reporting income monthly to Medicaid? It's never been questioned for self-employment.
Okay. It's mainly if you have major changes to your income. I recommend letting Medicaid know. Sometimes based on earning levels, like if you're in the MedWorks program, your premium, you may not pay a premium, but depending on earnings levels, you may, and it's a sliding scale based on income. So it's good for them to know. Or sometimes you may be in other categories of Medicaid, and in order to continue to be eligible for Medicaid when working, then they can switch you over into another category. So those are some benefits to reporting. Social Security, you need to report to monthly. Medicaid, I just recommend, reporting if there's changes to income, maybe stopping work or taking on a new position and getting a big raise, or if there's a change in your living situation, or you get married, marital status, things like that. Just keeping them, updated on those sorts of changes.
Okay, so I'm not seeing any more questions, and we're right at our end time. So I want to thank you all for joining in today. Thank you so much, Stephanie. This was really good information for me, just to really always get a better understanding of how benefits work. And again, we will get this posted on our YouTube channel. If any of you want to join tomorrow for our keynote presentations and impact awards, registration for that will be open until 3 o'clock today. So we got one more thank you, great information and great speaker. Thank you.
Thank you all for your time. I know time is really valuable right now, as always, but especially right now. And I appreciate you guys coming on and learning more. And if you do have any questions, never hesitate to reach out.
Okay, thanks so much. And everyone have a good day and stay safe. Bye-bye.